Hey everyone, this is John Hansbrough with the LBO Group. I'm here to give you another healthcare update. Today we're going to be talking about hospital price transparency. So last week, a federal judge dismissed a case brought against the HHS by a coalition of hospitals and health systems about a new provision that's actually a new interpretation of the ACA set to take effect in January 2021. So hospitals and health systems would be required to not only post their charge master rates, but also their privately negotiated rates. Hospitals and health systems feel like this is an overreach of the HHS's authority, and that additionally, it would create confusion for consumers. Now, in theory, cost transparency should bring down the cost of healthcare for consumers, and in general, it's popular with consumers. So according to a Harvard-Harris poll conducted last year, when asked if medical costs are too high or too low, 88% of respondents believe they're just right, but 67% of those same respondents felt they aren't given enough detail or transparency around the cost of healthcare. So I guess if we look at another example in the world today, take laptops, for example. Let's say I go to Best Buy, I want to buy a new laptop, and I go to them and I say, hey, how much is that new MacBook going to cost me? They can't tell me, right? They say it's going to depend upon a bunch of different factors and who you are, and the price might be different for someone else walking in the door. I'd be pretty visibly frustrated as a consumer, and I would not have a lot of faith that I'm getting the best deal for myself. And that's a lot of what we see in healthcare today. So in fact, 88% of consumers out there favor a government initiative that would require hospitals, insurers, doctors, and other providers to publicly disclose their privately negotiated rates. Now, 46% of the respondents to that poll expect that prices would go down as a result of increased cost transparency. And I think most surprisingly, 65% of those respondents would still be in favor of that initiative, even if it temporarily increased prices. So as you can see, there's a huge appetite out there for increased cost transparency for healthcare from consumers. So at the LBO Group, what we're doing is helping companies understand how to use their data to improve benefits and drive down the cost of healthcare. It's your data, and we really believe you should be using it. So if you have any interest about that, drop me a message and we can get in touch. This has been John Hansbrough with the LBO Group. Have a great day.